This bill I like to call the Medicaid employer ambush. In the nutshell, it makes it look like we're hitting large corporations like Walmart and Amazon. We're going to sweep everyone else into the net and make absolutely certain that we don't have to live under those rules for government employees. So when this came out originally, and this got looped into the governor's budget, this proposal was framed as cracking down on big corporations, your Amazons, Walmarts, Target, that allegedly don't provide health insurance. Of course, we know large employers are already required to offer health insurance under federal law, but I do understand critics argue they don't always provide the coverage at the levels they should. So that's a fair debate. However, that isn't what this proposal actually does. Under this proposal, the 748 private employers in New Jersey with 50 or more employees enrolled in Medicaid would pay the state up to a $725 per employee per year penalty. It sounds simple enough until you ask a very important question. Who's getting caught in the radius? Well, Deborah Heart and Lung Hospital, they got caught. Medical transportation companies got caught. Child care providers get caught. Hospitality, repair shops. Seasonal employees, I believe they did a change for that. Keep in mind, many of these employers already offer health insurance to their employees. But you know what we do here in New Jersey? We crack everyone. So it doesn't matter whether those employees provide health insurance. Doesn't matter if they're a multinational corporation, nonprofit, or even your local Boys and Girls Club, because guess who gets nailed? The Boys and Girls Club. Once the cameras are gone and the press conference is over, we say, ooh, everybody's Walmart. Everybody's the big bad wolf. And this is where it gets even more absurd. Medicaid eligibility is not determined solely by the employee. So let's say your house has a child that's enrolled in Medicaid because eligibility standards for children are different than Medicaid standards are for adults. Or you might have a disabled family member, they may qualify. Household circumstances totally outside of an employer's control may result in someone in your family receiving Medicaid benefits. Under that proposal, the employer still has to pay a fine. Still has to pay a fine. But now, when we talk about the government side of it, it appears government employees are exempt from this. And there's 80 public employers in New Jersey with 50 or more employees enrolled in Medicaid. We know now that they are not paying this penalty. Of course they're not. But if they were, they would join the Boys and Girls Club because it would be the same rules. So the state of New Jersey, by the way, has 50 or more employees, and we have people on Medicaid. Rutgers University, New Jersey Transit, Department of Corrections, City of Newark, City of Jersey City, City of Patterson. The irony cannot be lost on anyone in this room. We are taxing the Boys and Girls Club and Deborah Heart and Lung Hospital, but if we were to turn this around on ourselves, we would be cracking these cities and ourselves and places like Rutgers. But the most remarkable part of this entire bill is that we are penalizing employers because workers are actually enrolled in Medicaid while also fighting federal rules that require people to prove they're actually eligible for Medicaid in the first place. So the Office of the State Comptroller reported recovering, now updated, thank you, Assemblyman Scharfenberger, was $132 million. Now it's $233 million in Medicaid fraud, waste, abuse, just in the last year alone. So imagine if we focused our energy on eligibility verification and stopping fraud instead of penalizing Deborah Heart and Lung Hospital and the Boys and Girls Club. How much more than $232 million could taxpayers save? Just remember, governor's calling this business friendly. You on that side of the aisle with a big smile, this is business friendly. It is not. Come on. Thank you.